4 years of pre-med, 4 years of med, 6 years of residency,
I'll take the
1 year of
radio
fellowship,
station.
and my Porsche is running lean on the way to work today. Where are you?
I noticed the variety of cars in the physician part of Travel Lodge.
You can tell the tree huggers. From
Yeah,
the,
exactly.
From the
Saw a Prius next to like
I
a.
like the guy who covers his car every day.
Yeah.
That one's my favorite.
So we're doing a ankle surgery operating room setup. Patient's prepping herself for surgery.
Sock off there.
This gentleman's just raiding the facility for medical supplies. I assume a drug addict of some type. Looking for painkillers.
I think you're probably, you could probably go to 7.5 or 8. All right.
Who are you, ma'am? Do you work here? Show me your badge. You're a nurse?
You got gloves, you got drapes, you got towels. You got to scrub your hands. You're a scrub tech? You go scrub your hands, or your gown and glove yourself. Do I need to wash them first? You need, well, no, you can't do anything yet until she's prepped, or I mean, she's set up. Who's ortho tech? Ortho tech. I'll take that. Yep.
I'll pat her first, or I glove up.
You can help with her. Doctor, you just kind of tell them what to do. Anything else you want? You're going to need some more. While you're forced with something. This is all on your test, people. I would watch very carefully. There's something somebody's doing wrong. All the way down to sterile technique.
Get up and be mobile, you lazy ass.
I'm
going to be floating around, FYI.
Let's just go with a ankle fracture. We're going to plate the fibula. Fibula? My nurse got to come over here and help her out. She just touched the glove. She's not. You guys catch that? She got to put her gown on. She just went straight to the glove. Now you tie her up. Yourself. What do you need? What else do you need?
What?
Doctor, you normally just tell. She listens. It's an 18-inch tourniquet. It's probably going to have to go low. Let's just go right behind right below the knee.
What's the
Actually, this is right behind the knee.
what's the protocol if you're doing ankle surgery? Where to stick the tourniquet most likely?
It's an upper thigh.
Okay, but it'll still work below the knee.
Yeah, normally we don't put a tourniquet right here. We normally put it right here. Let's just do what real life is. All right, we're going to change it from an ankle fracture to a bunion. Put a tourniquet down there. Calf, we call it.
You just tell the
Way to put that on.
person unconscious to
Why
lift their
is
leg.
the nurse doing that, not the ortho tech?
Oh.
He started. I didn't want to
I was
stop him.
just being helpful.
He was doing such a good job.
Was that a cylinder cast, Febrile?
He was just doing a donut.
No, you just kept going over the same area. You didn't. No, you're supposed to
He
like.
just graduated.
You're doing a cylinder cast bottom. That was
Why
awesome.
are you still doing it that way? Pull it off and hand it to him.
And the reasoning behind the ankle versus the upper leg is what? Just you don't want to tourniquet the whole leg if you're only working on the foot?
Yeah, if you don't have to.
Okay.
Then it'll work
Normally those things are on how they're on pretty tight, right?
Mhm.
Yes.
So you can't swivel it if it's...
Okay. Good. Then we'll go. Then it goes up there. What are you doing?
Oh, cool. I'm putting it back.
Oh, cool. You guys agree with all this?
That's only if you want to be nice.
Her head is anesthesia. I don't care about the head. Do you guys all agree with this? What about the heel? The other
Yeah.
heel's done.
Is it going to be elevated? Or do I?
Someone's going to need to elevate it. What you could do is grab like a bucket or a bottle, have it held up. That way you guys can both scrub at the same time. So grab something that'll hold it up, maybe a box.
What is usually under there?
Normally it's a saline bottle or an arm, a leg holder, kind of like what you see in the casters.
Oh, yeah.
You know, the little leg holder. You put those on right?
What, that bucket?
That might hurt her.
A towel?
That hurt you? I like that better. There we go. That's better. That's fine. There we go. Alright, see what you got. Doctor and orthotech need to do what?
Scrub up.
Orthotech and doctor.
The bunion.
The nurse.
Use a sponge. Just use the sponge on there. Not the bristle, the sponge. There you go. Fully in.
Oh, work with hands on it, done it.
Look like you have rooster hands.
Don't we want to put the thing down so we don't contaminate the table before?
That's the first thing I did. You guys are doing so good. Now I gotta yell. That picks the leg up.
Don't have your hand touch the table.
Other way.
Roll it like a condom. There you go. Lift it up. That comes out. Nurse.
Yes.
This comes on. Like that. Very good. Man, you guys almost had it. It's pretty good when I'm not yelling, huh? It's a sign you guys are learning. All the way up until that part. Fuck.
Under.
You normally don't do it that way. You normally come to the back, then you get to this point and then do what you're going to do. That's good. You can stop right there. Not bad. I didn't have to get too angry. Yeah, I thought they did a pretty decent job. They worked. You want to know the differences? They worked as a team. Did you see that? They worked as a team. He was wanting to do her job. She was doing her job. I mean, everyone was doing different jobs. They wanted to do each other. They wanted to help in some fashion, which is what you guys lack before. If someone wasn't on their game, you can say, hey, you should probably pad this or pad that. But they worked together as a team, and that was why they didn't get yelled at that much. Because maybe not everyone was doing the right thing, but someone was able to communicate, hey, this is what you should do, this is what you should do. And that's really what it's about, until you are the one communicating it and delegating everyone's job, or feel comfortable doing it. You're just part of a team. So, I don't know, I thought that was impressive. It always works this way, the very last time we do this, and that's why I try to tell you guys that out this whole process, from fracture reductions to gowning and gloving and doing this draping, it starts to come together. The problem is now, you're done. And you leave after this class. And hopefully you don't forget it. Not bad.
Question?
Question.
So the stand would have still been under there, underneath the drape,
No.
holding the leg up.
He took it out.
Okay, it stays out. They operate with it foot flat.
Yep, foot flat.
And they would cut away the fabric now and roll it back?
Yep. What they could do is cut right here and roll it back.
Mm-hmm.
Normally what they would have done before they put anything on, they would have put a 1000 drape or a U drape, plastic sticky, non-sterile, just around the tourniquet. So that it doesn't get, you know what I mean? Mm-hmm. So that once they make this cut, they don't want blood getting down into the tourniquet.
Yeah.
Or that's a way of compromising the sterility. So that's why they don't do that. They would put like a plastic down, maybe even a U drape, maybe a sterile U they put on before they put this.
And then
just something to so that it prevents sterility, or keeps it sterile.
But you're going to still have some of this exposed, even if you cut it back. Getting wet and
Exactly. So if you put a U drape on first,
mm-hmm.
then this, then it doesn't make a difference.
Okay.
And if the doctor wants to pad the heel, he'll normally just put a bump. This is normally what they do anyhow. They put a bump underneath here. One thing that we didn't talk about when it comes to ankle fractures and that kind of thing is most people have their tibial torsion where they rotate out a little bit, right?
Mm-hmm.
So how to prevent, sorry, I don't mean to bite your face, but how to prevent that or how to help that, because we want to operate on the lateral side. So what can we do? Oh, and that'll hold it just like that. Bump the hip.
Yeah.
You put a pillow underneath the hip, and it rotates them straight up and down. Some people are opposite. Some people, when they lay down, they do this.
It's like a special pillow or
So
something?
you're trying to keep the foot up at all times. But I will say most people rotate out. So you'll always have a pillow, and it's just like or not a pillow, but a blanket that you see in the clinic. The blankets, they're a little thicker than like a sheet. We'll always have a couple of them rolled up and ready to go. And all I do is roll the patient up to one side, stuff it in, put them down, and they stay up. We didn't talk about that, but that's one thing that we do for ankle fractures routinely. Any other questions? Good job. Okay.